How to take history in long clinical consultation scenarios in paces in simple and organized way. Firstly, the complaint analysis, asking about OCD, which are onset, course, duration. Is it acute, sudden, gradual, duration, for how long, and the course progressive or on and off, comes and goes. You can add for the pain complaint these factors. You have to ask about the timing, when exactly this pain comes, what improves this pain, and what worsens this pain. You can ask about the scale of the pain from 0, no pain, and 10 is the maximum pain. Then radiation by asking where this pain goes. For example, going up or down, going front or back, according to the nature and the site of the pain. Second point, the relevant system analysis. For example, if you have patient complain of cough, you have to ask about any short of breath, any noisy breathing, any nasal discharge, any symptoms related to the respiratory system. Third, the constitutional symptoms, particularly if you have patient with fever. You have to ask about this question initially, because if you have fever, you don't have relevant system. It might be systemic complaint. So you can ask about the constitutional symptoms, which are any change in the appetite, any change of the weight, any lumps or bumps, any night sweats, any night increased body temperatures. And it always guides you and point to something serious like cancer, infections, HIV or TB, and autoimmune. The fourth point, PMH, past medical history, including long-standing disease like high blood pressure or high blood sugar, any surgical history, and you can add any procedure. Sometimes patients will have history of pacemaker or dental extraction, so he can consider it like procedure, not surgery. Then the medication list. Whenever you have any long-standing disease, you have to ask about his medication and the question for medication. Are you compliant to the medication? Did you add any medication? Did you increase the dose recently? Any allergy? This question is very important if you have patient with infection and you are going to start him on antibiotics. If he has allergy from any of these antibiotics, you will be in trouble. Please don't forget to ask about it in any infection scenario. Herbal remedies. Some patient will complain with loss of weight or diarrhea or increased blood pressure, like licorice can lead to high blood pressure. Some herbal remedies can be used for decrease the weight and it can harm the liver as well as the kidneys. So if you have weird symptoms, you can ask about herbal remedies. Over-counter medication, always ask them if you have patient, for example, with medication overuse headache. The patient will take medication without medical advice. Next, the system review. You will ask quick questions about every system in a quick manner. You can watch them in the video I will share the link in the comment. Next, 6 point FTH. FTH contains family history of same condition, family history of cancer, family history of heart attack, according to your scenario. The travel history is very important if you suspect something related to a flight, long flight like PE, or some infections in endemic areas like TB, like malaria. You have to take full travel history if you suspect any of these infections. The last H for HIV questions. If you suspected HIV, you have to ask full questions related to the risk habits, like tattooing, piercing, blood transfusion, sharing needles, recreational drugs, and whenever you have any of these, ask more details, especially if this patient is having multiple partners. You have to ask, is it protected? The next point is, do you questions? Do you questions for three things? Do you smoke? Do you drink alcohol? Do you drive? Don't forget to analyze any of these if it is positive. The last point to ask, the job. Whenever you ask for the job, you have to ask what the impact of this complaint on his job and daily activity. Finally, whenever you hear 2 minutes left, ask about the concerns. Thank you.